A limb is amputated every 3 hours in Australia due to cardiovascular disease, and this is increased significantly to every 30 minutes if you're diabetic. Peripheral artery disease is the thickening of the blood vessel in the lower limbs, such as the legs, and sometimes it can also occur in the arms. Because the blood vessel is blocked and the lower leg is not able to receive blood and oxygen, you end up with dead tissue. So the amputation literally just removes that dead and dying tissue. It doesn't fix the problem.
Nick was beginning to show signs of gangrene. The tissues in the rest of his foot had also been quite damaged. His nerves had stopped working because they'd been without blood for too long, and some of the muscles had also been damaged as well. And so he had a foot that parts of it were alive, but it wasn't really much use to him.
You haven't really been walking far enough to have any trouble with it, have you?
No. To have an amputated leg, your whole activity, so your daily life changes.
We want to come up with a way of treating these patients, and one way is to increase the development of new blood vessels.
The hope for the future is to maintain, not to lose the left leg. Every 3 months he's going to check me out with the ultrasound, make sure the blood is flowing. If the blood is flowing, I've got no problems with it.
TRAIL stands for TNF-related apoptosis-inducing ligand. What we now know from our studies is that TRAIL is one molecule that can promote the development of these new blood vessels without any major side effects. What we would like to do is to identify an FDA-approved small molecule, a drug that's already being used in the clinic, something that activates TRAIL signals that we can use and promote new blood vessel development in our in vitro as well as our preclinical models. And this just means that we can get it to the clinic a lot faster.
If we find a way that we can influence TRAIL, we would certainly want to recruit people that have got peripheral artery disease and see whether it halts the progression of the disease, whether it improves their symptoms, and eventually, if the trial looks promising, then the plan would be that it would become part of the standard treatment of those patients.
Your contribution will help us identify new drugs to take into clinical trials and prevent limb amputations.